the shining light that we bear. We're the only ones to make her brighter, the only ones to make her better, the only ones to make Anambra shine. With our sweat and blood.
The leadership of Governor Chukwuma Charles Soludo CFR in Anambra State is fostering significant transformation in the health sector by recognizing the importance of affordable, qualitative healthcare and building on the foundation of Anambra State Health Insurance Agency. He is championing a robust approach to healthcare, expanding accessibility and improving services for the citizens residents in Anambra State. This is Solution Footprint, and my name is Chidimma Oranwa. Join us today on the transformative impact of Governor Soludo's vision on the lives of Anambra and the inspiring story of the state's quest to achieving universal health coverage. Let's fly.
In recent years, access to quality and affordable healthcare has become a pressing and contentious issue in states across Nigeria. Millions of citizens are still without adequate medical and insurance coverage, leaving them vulnerable in times of medical emergencies. However, Governor Chukwuma Charles Soludo CFR set out to tackle this problem head-on. The governor has taken steps to sustain provision of health insurance to Anambra. During the campaigns, election and even the post-election period, Governor Soludo consistently promised to make health care one of his top priorities, assuring that no one in the state would have to choose between putting food on the table and seeking medical treatment. He equally promised to work tirelessly to provide access to affordable and quality health care for all our citizens.
There were many hospitals without doctors and medical staff when we assumed office, 19 of them. Now we recruited over 300 professionals, doctors, pharmacists, consultants, nurses, and so on. And the other day I approved again 500 healthcare workers. Given our primary health care centers. We want to make medical services already available to everybody, especially to the poorest of the poor. Our health care services in Anambra can look to the point that if you belong to a ward, you will have access to a doctor. That is our goal. That's where we must be. That's where we are going.
Indeed, Governor Soludo understood the importance of healthcare and the positive impact it could have on the lives of Anambra. With that, he set out to make sure his promises were fulfilled. His administration set up with a plan that will benefit all residents of Anambra State, querying the main challenges faced in providing healthcare to the people. It was therefore identified that one of the main challenges was affordability, as many people can't afford to pay for health insurance, even if they want to. Another challenge was access. In some rural areas, there are limited healthcare resources available, making it difficult for people to get medical attention when they need it. And so, Governor Soludo knew that healthcare was a complex issue, and he sought out the expertise of healthcare professionals to create a feasible and effective plan. The answer was to ensure the sustenance of the Anambra State Health Insurance Policy, which is spearheaded by Anambra State Health Insurance Agency, ASHIA.
Under Soludo, the first thing I will commend him is that he inherited something good and he sustained it. Some people do, once they come in, anything the previous administration they are doing, they will discard it, so that all the glory will come to them. But he did well by sustaining it. I'll give him kudos for that.
When there's a change of government, there's a scatter of everything. We want to begin our own, we want to show our own, but that's not the soul of governance. That's sustainability. It happens in the church. you are witnesses to it. There are so many programs and so many initiatives he has rolled out. So Soludo has done so well in sustaining this program from Obiano and didn't stop it because he didn't start it. So that's a kudos to him, and we wish him well in that direction. Let him also translate into other programs too.
Anambra State Health Insurance Agency offers specific health services as contained in the benefit package to persons who pay an annual premium of 12,500 naira. This gives them access to care when they need it from a network of accredited health facilities across the state.
Anambra State Health Insurance Agency is a health financing mechanism institutionally set up by the government of Anambra State with a mandate of providing prescribed benefits of health care as contained in our benefit package, ranging from primary services, secondary services, tertiary, and just one quaternary care added recently to the residents of Anambra State, irrespective of where you come from. Once you live and work in Anambra State, the state government, through this health financing mechanism, which Anambra State Health Insurance Agency represents, provides an avenue for you to be enrolled into Anambra State Health Insurance Scheme to take care of your healthcare needs whenever you need them. From over 200 facilities, a network of healthcare providers that have been accredited, qualified to provide services within Anambra State Health Insurance Scheme. And our people are at liberty to select any of those facilities to go to after they pay a prescribed premium of 12,000 naira, which is very instructive to note that since 2018, that amount has remained the same. By 2022, when Governor Charles Chukwuma Soludo's CFR came on board, there was a need for us to increase that premium from 12,000 naira to about 18,900 naira to reflect the realities of the day. But Mr. Governor has insisted on providing the wide range of services that we have in our benefit package at 12,000 naira, which was what was obtainable in 2018. The inflation is biting, but this governor has insisted on having this benefit package to be given to our people who reside in Anambra, wherever they may be, at the cost of 12,000 naira per annum, which translates, when you break it down, to 1,000 naira per person per month. Governor Charles Chukwuma Soludo's CFR is committed, through the subsidy he gives to Anambra State Health Insurance Agency, to ensure that people will have surgeries that the cost is nothing less than 1 million naira done for them. And they pack their bags and go home because they have shown that commitment to pay 12,000 naira in a complementary manner, in a contributory system which the state social health insurance scheme, which ASHIA provides, renders to our people. To fulfill the mandate of the governor to ensure that nobody suffers catastrophic health expenditure, nobody gets into penury, nobody pays out of pocket because they want to seek health care.
The health insurance is open to anybody who resides in Anambra State, regardless of their state of origin or occupation. So far, ASHIA has enrolled over 230,000 persons from across the state who have access to high-quality health care ranging from medical conditions, surgeries, maternal and child health needs, among others.
By March 17, 2022, we were at about 140,000 beneficiaries enrolled in ASHIA for the 4 years. But today, in about 2 years of his being governor, Anambra State Health Insurance Agency enrollment is at about 230,000. So 90,000 persons enrolled in our scheme within 2 years. The political will to say, you know what, this is a social service, we must keep down the premium at 12,000 naira, irrespective of inflation, so that it will remain affordable to our people, is critical. Those are game-changing decisions that can only be taken by a governor who is so focused on delivering on the social needs of the people.
The plan was designed to be accessible to everyone with affordable premiums and low deductibles. Governor Soludo's health insurance plan was met with bipartisan support, and he swiftly began working to make it more real, especially to the poor, the forgotten, and the downtrodden.
Anambra State government has done well with ASHA. They take care completely, 100% of people's primary health needs and some degrees of secondary health needs. And to me, that's the most important aspect of health care. If you take care of somebody's hypertension very well, you won't develop complicated hypertension. If you take care of somebody's appendix very well, acute appendicitis, you won't have the ruptured one. So if you take care of people at their primary and secondary health needs, they won't have tertiary health needs.
For the time being, our facility, the Immaculate Heart Hospital, Aguilera, has about 1,100 enrollees under ASHIA. While some are expiring, new ones are being enrolled. And the partnership between our facility and then the agency has been very beneficial to the people. Why? In the past, since 2019 I came over here to date, you always meet one case or the other, one person or the other, one client or the other who will come to the facility for one health need or the other. After physical examination, you realize that the person is physically sick, clinically down, but has no means to access the health care. But with 12,500 naira, the person gets enrolled for 1 year. And anytime you access health care at the end, as long as the medications are covered, you only pay 10% of your medical bill. That is a very big leverage and is a very big encouragement to our people and a big motivation for them to access quality health care, and the modern one for that matter.
Anambra State government has made sure that no one is left behind. It is working to ensure that the policy is implemented seamlessly and that Anambra can access the healthcare they truly deserve.
So when the managing director of that scheme, Dr. Onyemechi, introduced the scheme to Umueri and to me personally, what I did was to quickly call my cabinet members and told them about the health insurance scheme. Everybody in the cabinet bought the idea, and we insured every member of the cabinet. We are about a total of 44 in number. I did not stop there. I went ahead to sell the program and the idea to Umueri people in America. So when I finished selling the idea to them, they held their meeting and they bought into the idea and they sponsored 100 people. They paid money for 100 people. So I want to commend His Excellency. It's a wonderful initiative because health, they say, is wealth.
Governor Soludo is working with state agencies and healthcare providers to streamline the process. He also made use of technology to make the application process easy and convenient.
By prioritizing health insurance in Anambra State, Mr. Governor is ensuring that quality healthcare is within reach for everyone in the state, irrespective of socioeconomic status. More awaits you.
In order to further deepen this initiative and increase coverage, Governor Soludo's ingenious administration provided free health insurance cover for all keke riders, bus drivers, and other commercial road transport workers operating in Anambra State who paid their levy to operate since September 2022.
This country is if you don't have money now, it's really difficult to treat yourself. And that matter government don't matter because some like before, when your time you're sent to your basically go for free treatment. To be sincere concerning Soludo is the Messiah. To be sincere with you, Irutupuna Madu, Soludo, since all battle. In fact, in the remember, although we saw battle after the car, Nyota. Mana as time goes on, all the reduce the price they go on and indicate. In fact, only open up one year can and gas in a Soludo government and dying to Panya Fiona Lunobodo. If I'm a Soludo, Meline, especially even the Keke or Mekalani is busy. Buna, thanks, and I was Kita, Guy Manaro, Kalanka in the Mebum. Mbom aina njaburu na anu ibata wona na ngina njaburu ke into 3 mo one na baga buru ko 2 mana kita so video me record la anyi nzo nothing like aburu kita bo na ibata egwo ticket gi monthly this thing gi 2000 so every week Eguonia is no one. Iya, but number say you problem. It's a way I do. But I mean, oh, Makacha, so no one register. Makacha, Macodema for your health. Are you registered here? I will make small in the volume in the match. Money register match. Oh, I will make small. Bonnie, you shall know. Open you will be a brown. I have not attended again. Attend the egg, it will be very small. You know, you won't my room at American at 50 come. Oh, all get Beneto and Doctor Booking one beach. Oh, I can always borrow children and learn all. Making a good yet and all in your ball. Never get like but it says we can all one. Eh? Make an excellence is a ludo. No one alone. Next, you kind of get you one, Emma.
Worth mentioning as well is the expansion of Anambra State Health Insurance Scheme Benefit Package to include high-end investigations and services like magnetic resonance imaging, CT scan, prostate surgery, TVS scan, surgery for fractures, as well as infertility investigation for men and women.
I know some of my patients that came to me and said, we have this surgery to do, but the money is not there. I said, well, one of the ways you can actually take care of that is to, if you can enroll, because I know there are some surgeries that ASHIA covers. So it's been helping, and you can see like today, the number has been increasing. Like at the moment, we have 6,000 plus heads enrollees. And at the moment also, the facility has been trying to satisfy our clients.
You see the smile that ASHIA puts in the faces of patients. So many of them who cannot afford their surgery. A lady came the other day. She did an IVF. She wanted delivery, and when they told her where she went to register the issue, the cost of cesarean section, she was like, how can she afford it? So somebody said, why don't you do ASHIA? And she did ASHIA, and last month she switched over and she was like, oh, thank God I did. She said, thank God. When am I going to pay all that money they're talking about? I said, no. As far as you have a code from ASHIA, you will pay a certain amount.
Anambra State Health Insurance Agency, ASHIA, has equally digitalized its processes from enrollment to pre-authorization of services and payment of claims to hospitals. This has made ASHIA to pay claims to hospitals within 14 days of rendering the services, compared with 60 to 90 days claim settlement period obtainable anywhere else in Africa.
The capitation, they've improved, they've changed. The fee for service, they've improved. I can't say exactly the number of lives we have, but I'm sure it's more than 1,500. The capitation comes at the end of every month. You always look for weeks, 28 or 29, the capitation has come. They don't owe. And the fee for service comes 14th or 15th of the next month. They don't owe.
For doctors and healthcare providers, this technology-driven efficiency has made hospitals highly motivated to render services swiftly to ASHIA beneficiaries. They can focus on providing quality care to their patients without having to worry about their ability to pay.
When I came in, for instance, they were measuring hemoglobin by the blotting paper, where you compare color. And then the money in the ASHIA post was sitting there, and I said to Dr. Nyemechi, is it possible for us to use your money to uplift the house? He said, but that's what it is for. And I said, okay, anything we do. If you come to the laboratory, we have automated machines now, courtesy of ASHIA. You come to dental, you have modern dental chairs, courtesy of ASHIA. I can tell you that without ASHIA, this hospital will not be standing. Courtesy of ASHIA. Most wards are provided with generators. If you enter our stores, if you enter a respective wards, if you enter the theater, you will see courtesy of ASHIA. Because our enrollees are between 4,000 to 5,000 enrollee numbers. For us to go and pick doctors in the night when we have emergency, previously it was a problem. But courtesy of ASHIA, we have a Sienna vehicle that once you say a patient needs intervention at odd hours, you go and pick the anesthetist, go and pick the doctor.
Yeah, we, as a manager and the management body, we saw the program have some potentialities, and also for the people helping the people and also helping the hospital. So we now started developing the place and the area, environment, making it friendly wise so that people, even input of staff, they have to put more staff personnel into that unit. And also the environment they stay, make it friendly. As the program went on, you had to also enroll all of the staff of the hospital. The hospital renewed for all 300 and something staff here. From our pocket, we renewed for all of them.
No doubt, the impact of Governor Soludo's health insurance plan is being felt across the nooks and crannies of Anambra State. Testimonies abound as citizens who were struggling to pay for their medical bills now have reasons to applaud Governor Soludo's plan. They can now afford the treatment they need.
This is not my first time of enjoying ASHIA, that is using ASHIA to deliver. This is the second time, and I love everything about it, but it has saved me a lot. I knew about it when I delivered the one that's senior this one. Then I joined, and I saw the benefits. I delivered with a huge, with operation that is with CS as well, that one. But ASHIA covered everything, so I just paid a little dime, 10% of the amount. So we are surprised. Everybody, all members of my family, we are rejoicing, thanking ASHIA because they've saved us from that debt. So being an ASHIA member is a very good thing.
So when I noticed that I have a lot of difference in my system, so I visited the hospital. So when I came to the hospital, I came to know about ASHIA. I never knew about it, so someone introduced me. So when I knew about it, honestly, it has been very nice. It's really a good thing that I came to know about ASHIA. I was diagnosed with fibroid, so I underwent a lot of processes in terms of medical, laboratory, and the rest. So after which it was the surgery took place last week Wednesday, and it was successful. So like today I'll be discharged. So all thanks to the government.
I've been using ASHIA up to 2 years or 2 years plus now, and ASHIA has been helping me so far now. I gave birth yesterday night, and their payment is very, very good. I will pay 10% of my bills. So I'm very, very delighted to be in ASHIA. I say thank you to Governor Soludo. Thank you to all the organizations. You people are doing great. You are doing well.
To the glory of God, in Anambra State, Governor Chukwuma Charles Soludo has shown that positive change is possible. His tireless effort to provide affordable and quality healthcare to all his constituents stand as a testament to the power of good governance. May his example inspire others to follow in his footsteps.
Through the renewed efforts of Governor Chukwuma Soludo's administration in the state health insurance scheme, the residents of Anambra State can now enjoy improved services with less financial burden. And that's it on today's episode of Solution Footprints. Follow us on our social media handles as Solution Footprints on Facebook, YouTube, Instagram, and TikTok, and Solution FP on X, formerly Twitter. My name is Chidimma Oranwa. Join us next week for another interesting edition of the program Solution Footprints. Bye, Kemesian.
Every breath of our lives, we've trust in God.